Hi, welcome back, everybody. Today we are going to have a look at health beliefs and more specifically our own health beliefs, why they matter, and how they can affect our well-being. And to do that, we are going to explore some ideas from social psychology. But also, as with everything that I do here on the channel, that is coming at this from a biopsychosocial perspective, and that means all aspects of the things that affect our health, including our social world and our relationships and things like that. It's not just about our physical bodies. So, we might have this idea of what health beliefs are because we've all got them. We all have that subjective experience of holding these beliefs. But with a bit of reflection and a bit of insight on our own experiences that we're having, we might be able to recognize why we hold them. So, for example, if one of your parents died at a young age of, say, a heart attack, then you might grow up to believe, because of that experience, that cardiac conditions have a poor prognosis. And you might believe that the condition is hereditary, whether that's true or not. And that might lead you to change your health behaviours. You might choose to live a healthier lifestyle and exercise with a great diet to try and avoid that same condition that tragically affected your parent and ended their life so early. But perhaps you also, because of your belief, react differently, and you might decide that, you know what, carpe diem, YOLO, we're here for a good time, not for a long time, right? And you might decide that you're going to just throw caution to the wind and really just live your life the way you want to. And that can cause you to engage in more risky behaviors, maybe, or also there could be more risks to your health from some of those behaviors potentially. So there you've got two possible ways of behaving that have come from those health beliefs that have come from your life experience. So in either case, those beliefs will be impacting on your health behavior, but also those outcomes in the long term for you and your well-being. Another thing that can be true about your health belief is that it can affect the way that you interact with clinicians, healthcare providers, when you do get sick. And your beliefs might even impact on whether you seek help at all or how early you do so. Which can have a profound effect on any treatment that you're having, any interventions. So yeah, it can have a real effect. It can sometimes be a life or death situation. Another thing we can consider about your health beliefs is it can affect the way that you see other people, and it can affect the way you behave towards them and you treat them. So your health beliefs, especially towards people who have long-term health conditions, disabilities, mental health difficulties, if you hold certain beliefs there, it can certainly change the way you interact with those people. Because of this as well, health beliefs do have the potential to impact on public health. They can affect groups of people, the well-being of an entire group or community, or even a whole society. And of course, as well, when we go out further than that, those health beliefs can also be linked to inequality and things like poverty and discrimination. So when we have a look at these health beliefs and we try to get to understand them, we're going to come at this from the point of view of a health psychologist like me, of course. And we are experts when it comes to health-related behaviours. So I'm here to give you some insights into why these beliefs are important to our health and how those work. So first we're going to have a look at the factors that contribute to those health beliefs, and we're going to try and get to understand them a little bit better. So here we can look at the basic idea. It's an easy one to get. The idea of threats to our health versus the benefits to our health of anything, a given intervention. And that involves our perception of our susceptibility and severity of a condition. That means our beliefs about how vulnerable we might be to the likelihood of getting a disease or a condition, and for that condition to be serious or a threat to our life. So let's give an example. So we might think that because maybe you're in your 30s, we're pretty fit, and there's a really low possibility that we're going to catch COVID-19 and end up on a ventilator or die from that infection. So in that case, we might not seek treatment when we do catch the bug, or we might not take a vaccine, we might not change our social behaviours around other people due to that belief, that health belief that we hold. So what about the perceived benefits of taking a vaccine? Well, we might decide that even though we don't feel vulnerable or susceptible to the severity of disease, that we might take the vaccine anyway. But why are we doing that? Well, because our beliefs could also be shaped by our social world and our relationships with others, right? So we take that vaccine so our mum doesn't worry about us. We take it because we want to keep our family or our dear friends or colleagues safe. So you could say here that perceived benefits are social for us, and they've influenced our behaviour. So let's take another example here. Let's suppose that we got diabetes and also obesity, and we look at the benefits of vaccination. And we inform ourselves, and we come to understand that we are vulnerable to the infection, both in susceptibility and severity. So we're sitting here believing that we're more likely to catch this bug, more likely to be seriously ill from COVID or die from it. So then we look at the vaccine and we ask ourselves, well, is this going to benefit me? And maybe we might decide that it won't. Perhaps we might be worried about side effects or whether it will be effective for us. So in this example, we can see that even though in this case we do believe that we're threatened by this disease, we don't see the benefit and the health intervention of the vaccine. So because we don't see that benefit, we're unlikely to take up that health behaviour of getting that vaccine. So unless the perceived benefit is there for us, even in the presence of a perceived threat, we're not going to take that vaccine or change our behaviour or participate in this health intervention because we do not think it has any benefit to us, or in some cases might even present an additional risk, like in our example. Or it could be that we just don't feel a certain treatment or intervention as something that we are able to access, or something that might cause us additional suffering. So imagine again that we're obese and we've got diabetes, and it's been recommended to us by our GP, our ever so helpful GP, that we get some exercise. Now, a barrier to that might be our perception that we just don't fit in the gym. Not others might judge us and cause us to feel even worse about ourselves, increasing our suffering. So these kind of social things could prevent us from joining that gym. They might also be a barrier to us doing any sort of physical activity when we're around others. So how can we help here as a health psychologist? Well, by understanding the health behaviours and the beliefs, we're able to formulate health interventions that are effective, but also accessible and successful in reducing barriers around health beliefs. So what might we do here? We might make a nice peer support group, including exercise for people who are overweight, who have diabetes or pre-diabetes. And we're reducing the barriers around shame and stigma and helplessness. So all those difficult feelings that someone might have. So that our client might be experiencing as a barrier to that intervention. So by doing that, we can really improve health outcomes, well-being, confidence, and of course happiness for our client in the long term. So, as well as working with an expert or a scientifically formulated intervention, something specialist for your condition, it's also a really great idea to be as informed and educated as you possibly can about your particular condition. And there are lots of ways to go about that. Specialist charities are a really excellent place to begin when it comes to getting appropriate support and information from a reliable place. And you can also potentially meet lots of other people in a similar situation to you and gain that really valuable peer support. I talk about that a lot on the channel, the amazing power of peer support. So I'd encourage you to seek that out. So finally, we've also got to recognise the huge issue of trust here when it comes to health professionals. It's something that is really very important when you're facing any kind of health or well-being issue. And it's something that can affect and also be affected by your health beliefs. So when you're sick and you're not feeling your best, that can make you feel very vulnerable. And finding a clinician that you can trust and who you feel listens to you, you feel heard, that is really important. So whatever your health beliefs are, or whatever your condition might be, I would encourage you to look for that when you're looking to find someone to help or support you with an illness or a condition affecting you. So to find that person and to build a trusting therapeutic relationship with them is going to be what you want to do. So I hope that this video has helped to give you a little bit of insight and maybe cause you to think about your own health behaviours, where they come from, what they mean to you, your well-being. And yeah, how they affect your relationships maybe, and yeah, there's a lot to think about, there's a lot to reflect on. So I really encourage you to do that. If you've got any questions or you want to share your thoughts about health behaviours or anything else, or your experience of having a particular condition, just feel free to do that in the comments, and don't forget to stay here, stay subscribed for more weekly videos all about health and psychology and well-being and of course happiness, all done with compassion and curiosity, of course. So I will see you again next week. I hope you have a happy week, and yeah, I will see you next time. Thank you for joining me.